If you are new to Medicare this year or interested in the changes that are happening to Medicare for 2023, then this is the video for you. Today I am diving into Medicare Explained for 2023, so stay tuned. So when we're talking about Medicare Explained, Medicare 101, we want to review the parts of Medicare, when to enroll in Medicare, how to enroll in Medicare. We're also going to talk about the costs of Medicare in 2023 and how to find the best Medicare plan. In going over the parts of Medicare, we have Part A, that is your hospital insurance. You have Part B, that is your medical or your doctor insurance. You have Part C. This is an optional part of Medicare, also known as Medicare Advantage, and we'll dive more into that in a little bit. And Part D is the part of Medicare that covers your prescriptions, the drugs that you go pick up at the pharmacy. Medicare Enrollment. So your initial enrollment period when you're turning 65 and you're first eligible for Medicare, it's a 7-month window that begins 3 months before the month you turn 65. It includes your 65th birth month, and it lasts up to 3 months after the month that you turn 65. That is the window where you can enroll in Medicare, also known as your initial enrollment period window. As long as you enroll before the month that you turn 65 in those first 3 months, your Medicare effective date will be the first day of the month that you turn 65. So if I turn 65 on June 15th and I enroll in Medicare before June, my Medicare effective date will be June 1st. The trick here is if you are born on the first of the month, the rules are a little bit different. So if my birthday is June 1st, then I'm actually eligible for Medicare starting May 1st, starting the month prior. So that's kind of the exception to that rule. If you are collecting Social Security benefits at least 4 months before you turn 65, then the government automatically enrolls you in Medicare Parts A and B. You don't have to do anything. You'll receive your Medicare card in the mail. No other action required. But if you are not collecting Social Security benefits before you turn 65, then you do actually have to enroll in Medicare in most cases in order to avoid a penalty. And you can do that by enrolling online. That's the easiest way at ssa.gov/Medicare. You can also call Social Security or contact your local Social Security office to get enrolled in Medicare. The two main parts to Medicare, what we call traditional Medicare or original Medicare, is made up of Parts A and B. And as we reviewed before, Part A is your hospital insurance, Part B is your medical insurance. Part A is usually free, and this is the part of Medicare that covers your inpatient hospital care, skilled nursing home care, some home health care and hospice covered by Medicare Part A. Part B is your outpatient medical doctor insurance. And this part of Medicare is not free. Many people are surprised to find that you do have to pay a premium for Medicare Part B. And in 2023, that premium is $164.90 per month. And again, this is the part of Medicare that covers doctor's visits, outpatient services, testing, and many other medical services. While most people pay $164.90 per month for Medicare Part B, you could pay more if you are considered a high income earner. So this is for full Part B coverage for people in 2023, the way it looks based on your income. Again, most people are paying this, but if your adjusted gross household income from 2 years prior, so they're going to look at your 2021 adjusted gross household income, if it falls into one of these higher income categories, then you will pay a higher premium for your Medicare Part B coverage. And we have another video that I will link above that goes over how to appeal these IRMAA charges if your current income is maybe a little bit different than it was 2 years ago. So be sure to check that out if you fall into one of these higher income brackets. So when you have Medicare Part A and Part B, what are your out-of-pocket costs associated with that? Let's dive into that a little bit. So for my Part A services, let's say I get sick, I need to go into the hospital. What am I responsible to pay? Well, there is an inpatient hospital deductible of $1,600 associated with Medicare Part A. This is not an annual deductible, it's per 60-day benefit period. So potentially could meet that deductible multiple times in a year if you have more than one hospital stay in a calendar year. And after that, Medicare will cover your hospital stay up to day 60. For days 61 through 90, if you're in the hospital that long, you will have to start paying $400 per day. That's your co-insurance amount associated with Medicare Part A. And if you use your extra lifetime reserve days after 90 days in the hospital, that co-insurance goes up to $800 per day. Additionally, for skilled nursing facilities, Medicare will cover your first 20 days in a skilled nursing facility, but after that, you are responsible to pay $200 a day for days 21 through 100. What are your out-of-pocket costs associated with Part B? Now, Medicare Part B, your medical doctor insurance, has an annual deductible of $226 per year. And after you've met that deductible, again, deductible, you have to pay that first before your coverage kicks in. After you've met that, Medicare will pay 80% of the Medicare approved amount. You pay the other 20%. Now, important to know that there is no cap on that. So if you have very big outpatient medical bills, you do have to pay the full 20% of the cost. There is kind of no cap or limit associated with that. Because of those potential out-of-pocket costs, most people are going to want to look into some type of supplemental coverage to help cap that out-of-pocket exposure. And they usually do that in the form of either a Medigap or a Medicare supplement plan, or they look at Medicare Part C, also known as Medicare Advantage plan. So I wanted to look at this little chart here today to talk about what those main options are and kind of how they work. There are two main ways that you can get your coverage when you're on Medicare. And really all the different plans you see, the different advertisements, they all fall into one of these two paths. So the first path is staying with original Medicare, traditional Medicare Parts A and B. You're receiving those benefits through the government Medicare program. From here, you decide if you want to add on Part D, prescription drug coverage. This is purchased separately through private insurance companies that are contracted with Medicare that offer Medicare Part D approved drug plans. And Part D drug plans can run anywhere from $5 a month in most states up to $50+ a month. So it just depends on which type of drug plan you want or need. And I have another video that talks all about Medicare Part D. It's linked below. It also talks about the penalties that are associated with Part D if you go without a Part D drug plan. So it's important to be aware of those. Be sure to watch that video. Additionally, many people will want to add on a Medicare supplement or a Medigap policy. And what this does is it fills in that 20% that Medicare doesn't pay. It also helps to pay those hospital deductibles and co-insurance amounts that Medicare doesn't pay. So Medicare supplement insurance policies are supplemental or secondary to your original Medicare benefits. One of the reasons people like them is because they are your secondary insurance. Medicare is still your primary insurance. You can go to any Medicare doctor anywhere in the country. So there are no networks associated with these plans. And because they fill in the gaps in traditional Medicare Parts A and B, you have very little out-of-pocket exposure. So you have very low deductibles and co-insurance amounts that you're responsible for when you do go this route. So again, going this route, you can choose your own doctors, any Medicare doctor in the country you can go to. You also have very low out-of-pocket exposure if you add on a Medicare supplement plan. The other route, the other path that you can choose is to do a Medicare Advantage plan, also known as Part C of Medicare. Now, these are managed care plans like HMO or PPO type plans, and Part C Medicare Advantage plans combine the benefits of Part A, Part B. They usually include Part D prescription drug coverage rolled right into the plan as well. And what these plans do is they essentially replace your original Medicare benefits. So you do have to be enrolled in Parts A and B in order to be eligible for a Medicare Advantage plan. But if you enroll in a Medicare Advantage plan, let's say with Humana, when you go to the doctor, the hospital, that doctor and hospital is not billing Medicare anymore. They are billing Humana. So your Medicare Advantage plan is your primary insurance. You're no longer using your red, white, and blue Medicare card at the doctor and hospital, even though you still are enrolled in Medicare Parts A and B. So Medicare Advantage plans have lots of different pros and cons. I have a few different videos that I'm going to link below that talk about the pros and cons of Medicare Advantage plans and who they are a great fit for and who they may not be a good fit for. So be sure to check those out before you make your choice. Medicare Advantage plans in most parts of the country start at $0 a month. You still have to pay your Medicare Part B premium in most cases, but the plans have no additional monthly premium. And many of these plans do include additional benefits like dental or vision coverage that is not necessarily included in traditional Medicare Parts A and B. Additionally, Medicare Advantage plans have their own set co-pays and co-insurance amounts that you will be responsible for most covered services. So if you go into the hospital or you're having an outpatient surgery, you're going to have a set copay or a set dollar amount that you have to pay, and that is established by your Medicare Advantage plan. Something really important to keep in mind if you're new to Medicare in 2023 and trying to decide which of these paths you want to go down is that Medicare supplement insurance plans do not have an annual open enrollment period in most states. So if you want to purchase one of these Medigap plans that fills in the gap in Medicare Parts A and B, you generally only get one open enrollment period where you can choose any plan you want, and there's no medical underwriting. There's no health questions. You don't have to health qualify. And that is when you're first turning 65 or when you're new to Medicare Part B. So that's generally your only opportunity to choose any Medicare supplement plan without any medical underwriting or health qualifications. Medicare Advantage plans, on the other hand, do have an annual open enrollment period, and you never have to medically qualify for a Medicare Advantage plan as long as you're enrolled in Medicare and you live in the Advantage plan service area, then you'll be eligible for that plan. So a lot of people ask me about switching back and forth between these two paths. You know, if I start here, can I go here? If I start here, can I go there? And it's important to know that if you start here with a Medicare supplement plan when you're first turning 65 with traditional Medicare, yes, you can always go to a Medicare Advantage plan during the fall annual enrollment period. That will be an option for you. However, if you start here with a Medicare Advantage plan and then down the road you want to go here and purchase a Medicare supplement or Medigap plan, you may or may not be able to. It depends on your health because it will be medically underwritten in most states. There are a few states that have some different rules, and I'll include more information about that below. So when it comes to deciding which type of Medicare plan and which insurance company is the best for your needs, that is where we can help. So my team and I are licensed independent insurance brokers. We work with both Medicare Advantage plans and Medicare supplement plans. So we represent most all of the major insurance carriers in almost every state, and we are here to help you. Our service is completely free, and we're able to conduct a needs analysis to help you figure out which type of Medicare plan will be best for your needs and your budget. And if you work with an independent broker, we're also able to offer policy service to you over the life of your policy. So if you ever need help with claims or billing issues, we are here to assist with that. And again, our service is completely free to you. So please feel free to give us a call. We would be more than happy to assist. Thank you so much for watching today. I hope that this little Medicare 101 crash course helped to get you some information that you've been looking for. Please check out the other videos on our channel. We have a ton of information about Medicare, and almost every question you have is probably answered somewhere in one of these videos. And you can also leave any questions and comments for me below and reach out to us with questions as well. So thanks again for watching, and we'll see you soon.